Welcome to the Thinking Practitioner podcast.
A podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Luchau.
Welcome to the Thinking Practitioner.
The Thinking Practitioner podcast is proudly supported by ABMP, Associated Bodywork and Massage Professionals, the premier association for dedicated massage and bodywork practitioners like you. When you join ABMP, you're not just getting industry-leading liability insurance, you're gaining practical resources designed to support your career, from free top-tier continuing education and quick reference apps like Pocket Pathology and 5-Minute Muscles. ABMP equips you with the tools you need to succeed and grow your practice.
And ABMP is committed to elevating the profession with expert voices, fresh perspectives, and invaluable insights through CE courses, the ABMP podcast, and Massage and Bodywork magazine, which features industry-leading experts like Luchau, my partner, and myself, and of course our special guest today. Thinking Practitioner listeners like you can get exclusive savings on ABMP membership at abmp.com/thinking. So join the best and expect more from your professional association. So, Till, good to see you. And who is our special guest today?
Our special guest today, Cal Cates. You're back with us. I'm so glad to have you here.
It's always a treat.
I'll try to introduce you. You are a writer, educator, speaker, and massage therapist, and you've been at the forefront, I believe, of integrating massage therapy into healthcare settings for over 2 decades.
Yeah, that's right.
And you're the executive director of Healwell, a nonprofit that brings massage therapy into hospitals and trains practitioners to work with people facing serious illness, death, and grief. Your work challenges conventional ideas about what it means to care, to connect, to show up with presence. And we're going to talk with you today about the role of massage therapy and bodywork in palliative and end-of-life care, and the cool-looking program you're developing at Healwell called mPATH. Did I say that right? mPATH.
You did. All of it.
What else should people know about you as we start out our conversation?
Oh, I don't know. I think that's pretty good. I mean, I think, but math isn't my strength, but I started doing this in 2005, so I guess we're not quite at 2 decades. But I definitely started doing this kind of work with palliative care and hospice right from the very start of my massage career, quite by accident. So it has really been what I've been doing the whole time I've been in the massage therapy world.
And I first got acquainted with what you do through an article you wrote in Massage and Bodywork magazine about chronic health conditions or dealing with illness. And I was still recovering from Lyme disease at that time. And I remember thinking, they nailed it. They got exactly what we need to know and think about and what we need to hold, and the impossibility of it, and the beautiful impossibility.
I had a similar thing to that. I remember this was at I'm thinking maybe an ABMP school forum meeting or an AMTA school. So it was a schools meeting of some kind, and I believe, and you were there we were having some kind of discussion about something, and you were just drilling down into a bunch of details about something, critiquing a thing that we were talking about. I was like, and I was thinking, I got to go talk to this person as soon as this meeting is over, because nobody said this stuff for a long time, and we have needed to hear a lot of what you had to say. So I noticed that from the very start. Like, I was super impressed by your thought process and your wealth of knowledge and expertise in those areas.
I'm so honored and lucky to call you both my friend at this point in my life and career, and similarly impressed by your work. And really, I mean, I feel like I came into the profession and you two were both pretty established, and to have an opportunity to go into the weeds, like you were talking about, Whit, and really kind of just think and feel about what it is to do this job that we do is just so fun. And I love your podcast for that reason. And certainly I love you guys for that reason.
Oh,
so
all right, thank you. And that was a very nice way to say that we're old and we've been around.
Right? Wasn't that so just elegant and smooth?
Yes,
Yeah.
Well, I want to talk today about
let's talk about old things.
Yeah, right.
Palliative care.
Yeah.
And maybe if you wouldn't mind starting, Cal, by telling us what that is and where a massage therapy fits into that landscape, both like on the philosophical level maybe, but also really practically.
Yeah, absolutely. Well, I think, it's interesting because when we were talking about how we wanted to structure this, we were talking about, maybe addressing some of the myths. And I think, Whitney, you teed it up perfectly. One of the myths is that palliative care is like for old people
Yeah.
and or that it is end of life care. And I feel like functionally palliative care, unfortunately, is still often care that occurs toward the end of a person's life. And it really, I think, comes back to our sense as a society and certainly as a healthcare system that dying is bad slash wrong slash something we should prevent at all costs, and that palliative care is an interdisciplinary kind of care that is an extra layer of support for people with serious illness. And what that means, and in the ideal world, let's say you're diagnosed with chronic kidney disease. That day that you get that diagnosis, you get a referral to palliative care. This is a disease that is likely to shorten and make your life more difficult. Wouldn't you want that extra layer of support right now? But what winds up happening is we say, oh, well, we have dialysis, we have these other things. We're not, quote, ready for palliative care yet. And when I think about what I've seen palliative care be, I'm ready for palliative care. Like, like my things hurt. I could use more energy. I, have like an extra layer of support would be amazing.
Yeah.
Walking with my wife through her 12-year cancer process,
Yeah.
and she passed almost a year ago now.
Yeah.
It was so clear that there was this watershed in the medical system between we're going to beat this and, oh, now it's time to wind down.
Mm-hmm.
Yeah.
And it was impossible to find people to have the conversations with in our pretty good care system here that helped us navigate that transition. The moments when we say, okay, so how do we even choose treatment options that make life better and aren't just about trying to fix or overcome or kill the cancer?
Yeah. And more life isn't always better life. And how do we talk about that? And
Yeah.
Yeah.
Our oncologist is really honest about that. He says, I ask those questions. How do we decide these treatments you're giving us? And he goes, well, my job is to kill tumors. And let me refer you to our supportive services for those kind of discussions.
Yeah.
So he was really honest about being a technician that was about, he's much more than a technician, but he was about curing this thing.
Yeah.
Yeah.
And then what I saw with my wife and what I've seen with other people close to me is that to say I'm ready for palliative care often means to themselves, I'm ready to die.
Right.
And that's a complicated moment.
Mm-hmm.
Absolutely. Well, and I will share your appreciation for the oncologist saying this is not my lane. And it's also part of the problem. It's this idea that by, I only care for you when we think you might still live for some period, right? But as soon as this gets sort of hard and nuanced, I will refer you out. And and I think medical care teams, palliative care happens everywhere. It happens in homes, it happens in clinics, outpatient clinics, inpatients in the hospital. But what we see is that the more mainstream providers, your pulmonologist, your oncologist, your cardiologist, these people make that referral just as you described, to like when it's clear that they don't know what to do or that it's not going, quote, the way that they and or the patient want it to go. And then they sort of make this referral. So you're sort of in crisis and being handed off to a new team. And this is yet another reason why palliative care really should be incorporated from the moment of diagnosis, whether it's a cancer that you expect to live through and that might even be cured, whether, that's still a serious illness. And what you get with a well-established palliative care team, and depending where you are, you might be looking at a doctor and a nurse practitioner, right? Or you might be looking at 6 doctors and 4 nurse practitioners and 3 social workers and a couple of chaplains and, a wide array. But that what you get is this perspective that right away starts to be curious about what does life mean to you? What does quality mean to you? And that I was listening to a podcast yesterday about palliative care ethics, and they were talking with this physician who continually, she kept highlighting that one of the most important skills for her as a palliative provider is comfort with uncertainty. And that this is one of the things that makes her valuable in these settings and in these situations, because when she gets consulted, it's because the family members and the person in the hospital bed or the person with the illness have different ideas, or like not everyone's on the same page, or the providers have a sense of what they think is the best plan, and that's not what the patient and or family wants. And so she shows up on the scene and everybody's in disagreement, and her job is to jump into relationship with these people she's never met at one of the hardest times in their lives, and that's what she does every day. So I think that we could do a lot better as a society and as a culture to recognize that we're all headed to the end of life, and that when you're there is not the time to have those conversations. And that the more we can really be with these bodies we're in are made to break down. They will break down. It's not a sign of failure that like we have knee pain or arthritis or, whatever things aging brings to us. This is what our bodies do. And when we fight it, we miss the chance to get that support early. And I mean, look at Jimmy Carter, right? Like he's the perfect example of how it could go. The guy kept graduating from hospice, right? Because he was like, this is going in a way that means my life will end, but I want all the help I can get as I head there. And I think that really makes such a difference. And for massage therapists, this is the piece that, people go, oh, this isn't for me. This isn't about me. I don't like hospice. I don't like sick people. You're touching people right now who are at the early stages of diabetes.
Okay, so you're talking about assumptions massage therapists might have about palliative care. This isn't for me because it's about dying, you're saying.
Yeah.
And you're saying that you have clients now that are dealing with the processes that palliative care can address.
Absolutely. And I think that we, as massage therapists, we really could function with the appropriate training. And I think many of us are not set up for success in this area, but it's well within our scope to be able to spot these early signs of what becomes serious illnesses: diabetes, chronic kidney disease, COPD, congestive heart failure. These are things that if we're seeing people on every couple of months basis, we're seeing more of them and spending more time with them than even their spouses or their roommates or other people who might see them, and certainly than their other healthcare providers. And if we can say like, this is some new swelling, right? Oh, I've noticed that this, like you have this cut on your leg and it doesn't seem to be healing. Or you've been talking about feeling kind of mentally foggy, and like being able to ask the kinds of questions that inspire that person to pursue other, to say like, maybe it'd be useful to see your doctor and maybe get this checked or that checked. And that for all illnesses, early diagnosis, early detection is the key to having the best outcome.
So there's a really practical way that bodyworkers, massage therapists can support a palliative care process.
Absolutely.
Well, philosophically, how does what we do support? How does what we do fit in? How does it fit into that landscape of things people need at that point?
Yeah, I mean, we were talking earlier about, catch me if my bias is coming out, right? But like, massage therapy is palliative care. Palliative care is intended to lessen suffering. That's the basic goal of all of the interventions that are considered palliative care. So when people come to you, even if you quote see healthy people, they wouldn't tell you they are suffering. They'll tell you their hamstring is pulled or that their back hurts, or right. But what's happening is they're having an experience they don't want to be having, and they want you to lessen the unpleasantness of that. And that really is what we're doing when we're working with people who are in a palliative care service. They're saying like, yeah, this swelling in my feet is uncomfortable, or it's 3 days since my last dialysis and the next one isn't for 2 days and I just feel sludgy and gross, and like, can you help me feel better? And the other piece that's really becoming more prominent in palliative care now is with palliative care, the family is the unit of care. It's not just the patient. It's whoever is caring for that person. So it might be a spouse, might be a roommate, might be a good friend, but whoever the patient says is important to their ecosystem of care, that those are the people that the palliative care team is addressing and trying to support. And caregivers, unpaid lay caregivers, are in the millions in the United States. Like this is how we care for sick people, is that people who don't have any training or any support are raising kids and having a job and taking care of whatever, illness this person and their family might have. And part of our job as massage therapists as well, I bet you're also working with people who could easily be considered caregivers. They may not even be mentioning it to you, or they're mentioning it, but they're sort of mentioning it in an offhanded way. And when you start to look at the statistics about the poorer health outcomes for people who are caregivers,
Yeah.
that really starts to bring that into focus as well. How can I be curious about the best way to support this person who is ostensibly healthy, but is probably not getting enough sleep and is not themselves feeling supported and is living with mid to high grade stress about the concerns they have about this person they're caring for. And, even just worrying about your person is one thing, but these people are like changing chest tubes and like wound dressings with like YouTube videos. And, some of them have gotten some sort of training before the person that they're caring for has been discharged from, a healthcare facility. But there's suddenly, you have this person who's an accountant and you're like, oh, you're okay with, doing this basic daily medical procedure, right? And so, they give you some training before you go home, but now it's on you, right? You have this major responsibility to provide this aspect of care for your loved one that if you do it poorly, they could get an infection, they could get readmitted, they could actually die. And that is very stressful. So recognizing that is also a huge piece of what I think just isn't on our radar as massage therapists.
That the unit of care is the family or the support system
It's the whole
for
system.
the person.
Yeah.
I mean, that just brings a lump to my throat because I remember that moment. And unfortunately, the way it's structured for insurance purposes is either oncology or palliative care. And you have to stop treatment when you get into palliative care. I mean, often for payment purposes. But when we finally did get to that threshold, all of a sudden, and I remember that talk that our first palliative care nurse had with us, like, okay, so now we're thinking about both of you. I was the primary caregiver at that point.
Yeah.
And it was such a game changer for me because I had been holding so much, I realized, without even understanding how that my stress and overwhelm was part of the bigger system that needed to be addressed, cared for as well.
Absolutely. Well, and I think you pointed to something too, and your introduction to that part of the story, which is that hospice, there are distinct differences between hospice and palliative care, but the main, one of the main differences is that hospice is really a payment mechanism. It is a thing that was designed so that we could have a special kind of care paid for through insurance for people who were, quote unquote, expected to live 6 months or less. And palliative care, there have been so many mergers and hospice organizations merging with palliative organizations, two hospice organizations coming together. And a lot of times, again, because these referrals happen so late, palliative care and hospice are being confused. And ideally, like when we see a lot of chronic kidney disease patients. So when you are referred to a nephrologist, because it's obvious that your kidneys aren't going great, if that nephrologist says, you know what, we need to bring palliative care on board, palliative care doesn't replace your nephrologist, they just help. And that is how it should be. It's not like, well, now we're passing you off to these people who will, quote unquote, make you comfortable, right? Which is another euphemism for giving up, at least as it's culturally understood. But these physicians really can say, yeah, I actually don't have all the support. And even if I know all the things and have all these other skills, why wouldn't I want helpers? Why wouldn't I want you to have a case manager and a social worker and all these other things that are available? And I think there's just this like individual, sort of sense of I can do this. Oh, until suddenly I can't. And then it's just not good care is really what winds up happening is you get handed off really kind of in a janky way and it winds up being hospice when it could have been palliative care. And that is a disappointing outcome.
Yeah. I was struck by something both of you said in terms of your experience with this with Loretta and Cal, what you were saying too about the time frame of seeing a practitioner in the treatment that you're having being very short oftentimes, because that's their focus, is to just administer or talk about this particular treatment. And that's one of the things that I think maybe a lot of massage practitioners don't recognize, is that once we start spending a whole lot more time with somebody, there's a lot of opportunity and a much greater chance that some of these things are going to come to the forefront that really would be very beneficial for you to be thinking about some. And I know Cal, you and I have talked about this a lot. Like, this should be in our training also a whole lot more than it
Definitely.
is. Yeah.
One of the physicians I work with says that the intervention in palliative care is communication.
Yeah.
And that, yes, there are all these different disciplines included in the ideal palliative sphere, but each of those clinicians, by having a palliative specialty, has been trained in advanced skills of communication and noticing, and sort of, there's now a code where physicians can be reimbursed for having advanced care planning conversations, which like, it's progress, right? We have to be glad about it, but
Yeah.
that's not one conversation.
Uh-huh.
And, this is one of the things that continues to come up in the palliative training that I've been able to do, is that the trust gets built over a period of months and years, so that clinicians can be up to date on, where is this family now? Where is this patient now? 6 months ago, they didn't even want to talk about a do not resuscitate order. But because we've kept those lines of communication open, and because I've been able to share with them and just even ask questions, and this is the thing that massage therapists go, that's none of my business. And I couldn't disagree more. You're not advising your clients.
Mm.
You're asking questions that inspire them to wonder about things that then direct them to go ask the people that they have to ask those questions of. And there's a really great, there's a website called Vital Talk, and there's an app, actually, the Vital Talk app. It's free. And it gives you some scenarios about, like, so a person says this, how might you respond as a clinician? And it's fascinating how I've gotten better over the years, but a person expresses a concern, and in my role as a clinician, I want to fix it.
Mhm.
And, one of the real sort of underlying pieces of so many of the Vital Talk modules is about, this person doesn't want an answer. They're communicating emotion, but it's much safer to communicate that emotion as a question or a concern than to say, I'm afraid to die, or I'm
Yeah.
worried about my wife, right? They'll ask some sort of more oblique question. And as massage therapists, people, like you said, they say things all the time that,
Mhm.
a lot of times I think massage therapists just freeze in their tracks. I don't know what to do about this. I'm afraid that engaging in this thing that this person has brought up will be out of scope, and that I won't be able to. Your job is to listen and be curious, and to hear suffering when it is expressed. And Westerners, we don't communicate directly. Most of our communication is oblique. So our job as providers who are showing up to suffering, whether that suffering is a sprained ankle or kidneys that are on their way out, is to really listen to what's being said and what's not being said. And I feel like those are the skills that I feel like have allowed me to bring a unique value. My hands are the gateway, because certainly when I connect with your nervous system using my hands, there, theoretically, hopefully, a therapeutic alliance is created by the way that I touch you. And that opens a door in a way that might not be opened with a provider who doesn't touch you as part of what they do. But my hands are really just like hey, we're going to go somewhere intimate right now, and I'm just going to be here for whatever comes up. And the really being able to be there for whatever comes up is where that therapeutic value, I think, shows up for all of our clients, but certainly for people who are not feeling seen by their providers.
You described a scenario where our touch sets the tone or creates the context for the listening that happens. I'm just thinking about the classic stereotype of people getting into bodywork because they're not so comfortable talking. And when there's situations that come up where the communication, the C word comes in, like you said, you can back off and go, whoa, this is out of scope. How do I even talk to people? I don't know the questions to ask, the things to say. And you've painted a picture there where it's much simpler than that. We are in a unique position to straddle that the dichotomy or that clash between fixing and being with. And just by listening or just by touching, sometimes we help people negotiate that tension as well.
Yeah, I think one of the challenges that I see us having basically as a society in dealing with this is that from our educational system, we are trained to look for discrete segments of content information as our learning. Like,
Yes.
I want to be certified as a listener, like whatever is the thing. There's some
Yes.
kind of designated, skill set or credential that I can say like, okay, now I've got this. I know what I need to know. How do you advocate or best suggest massage therapists kind of grapple with this and think about how to be better at this? Because there doesn't seem to be as many like big flashy advertised courses about being good at this kind of thing,
Definitely. Well, and we struggle all the time because what students want is for us to say, if a patient says this, here's what you say.
Exactly.
Right. And that, we just had someone come and do some trauma-informed care modules with us and talking about how having a script has a kind of a violence to it and kind of like I'm not showing up to this engagement. I'm showing up to engagements like this. And I have an answer that allows me to feel safe and over here and leaves you over there with sort of the problem that you have brought to me. And, that's so deeply ingrained in our culture that I feel like it's very hard for practitioners to, my short answer is that it's not actually about talking, right?
Mm-hmm.
That this is a skill that is about emotional self-regulation, that's about self-knowledge, and sort of when a person says a thing that is activating, that like your nervous system responds to this thing. What is your conversation with your nervous system like when that happens? Do you even have a conversation with your nervous system, or do you feel that sort of pinprick and you just respond with a thing that you just sort of like toss between you and this person who's just created static in the field between you? And this is the kind of work that I think you can't learn this in a weekend, right? You can learn some sort of basic, like start noticing this, start like your body is an antenna.
Mm-hmm.
How do you use that antenna in a way that helps you to show up to what's happening here and to be aware that like, okay, this kind of situation, even before anybody opens their mouth, is activating. How can I ground and settle myself so that I can really be here for this?
Mm-hmm.
And, I was reading something just recently, something like 96% of people would say they're good listeners, but they actually retain less than 50% of what the other person is saying when they're in a conversation. And, I think that I feel like massage therapists, we think we're good at this because we're compassionate, right? Because we're thoughtful,
Mm-hmm.
because we've chosen to be in a healing profession. Of course, we're good listeners. And we're listeners of our culture. We've learned to listen for our chance to talk. We've learned to listen for the anchor that goes, oh, I know what this situation is, or I have a solution for this. And that this kind of listening that allows massage therapists to bring a unique value in the palliative care setting that applies everywhere. I mean, this is the thing, right? Like without the palliative lens, I might not have noticed this, but my favorite thing is when folks come through our courses who have never done this kind of work and they go, oh, I can use this with everybody, like with my wife, with
Yeah.
my kids, right?
Yeah.
And that we just, the settling and the willingness to allow, I guess I could just say that the willingness to allow is a skill that we could really strengthen and develop.
We're going to have Stephen Porges on the show in a couple
Oh, cool.
episodes. And he's fairly complex in his thinking and descriptions.
Yes.
But if I could oversimplify it, he's talking about co-regulation. He's talking about the way our own nervous systems interacts with the people around us, and that we basically do this thing together of winding up or winding down.
Definitely.
And
Yes.
you're describing, you're an educator. Whitney and I are both educators. We think about training and how do we teach this, and we design programs that do that.
Yeah.
But you're talking about a practice mentality too of just you said listening is hearing my own
Yeah,
experience, my own nervous system, and you called it a conversation. And for nonverbal channels, it might be simply, sensing or feeling into what's happening inside, and that being like the fundamental practice or part of
absolutely.
that interaction, that co-regulation that we do with people.
Yeah. Well, and I think it's funny that, you talk about Stephen Porges and then you talk about us being educators. And I think uh, uh, Deb Dana and other people who have picked up Stephen Porges's work and made it digestible for people. That's how, like, his idea is brilliant and overly complex unless you really want to nerd out about it, right? But people like Deb Dana have taken it and said, like, there's actually a beautiful simplicity to how the nervous system works. And it's not a linear thing, right? It's not that you go from like ventral and to sympathetic to like, it's not steps. But if you can recognize when you're in that dorsal state of shutdown, when you're in that sympathetic state of, and it's not fight, it's just activation, right? And so
Mm.
sympathetic isn't bad.
Yeah.
It's just different than ventral, which is like this sort of settled, connected state. And we've been doing some work in one of the courses we teach at Healwell with this. And Deb Dana has a great book called Anchored, and it's full of just these really accessible exercises to connect you to your nervous system and to visualize it and to feel that, like, all this stuff that like you didn't even know was there, but when she asks you to think about it, you're like, oh, that's what that is.
Mhm.
Oh, I could pay way better attention to that. And that would serve me, incredibly well in all my relationships.
Awesome. That's a
Yeah.
great resource. We'll put that in the
Yeah.
show notes.
Yeah.
Hey, I've been wanting to ask you this for a while, Cal. How did you get interested in this whole thing? What personally drew you into this line of work?
I don't, I mean, I feel pretty confident that like I am not here to be asleep in this incarnation, right? And so like everything from my upbringing to being gay to being trans to sort of like I've been invited by circumstance to really be curious about like sort of making the invisible visible in all kinds of ways from as a pretty young age. And I still don't even know why I went to massage school. It was kind of an accident. And then when I was in massage school, I was massaging my grandfather at the moment that he died. I didn't know he was that sick. He was in what I now know was a skilled nursing facility. And I did not grow up in a family that had normalized death or any of these sorts of things. But watching him take his last breath was amazing. And not a moment of emergency, and felt really like, that's that was wow. Like I, I I kept thinking like I should do something, right? Shouldn't I be doing something? But
Yeah.
all I wanted to do was stay there with him. And you know, I don't remember it being like, and now I must, bring this to massage therapy. But my career did sort of, this was about halfway through massage school. And so for my quote senior project for massage school, I volunteered at a hospice. And then I just started like thinking about, I bet what happened with me and my grandfather is not a thing that happens for people. I bet massage therapists are not part of this part of people's lives. And we should fix that.
You just let a big cat out of the bag. Not just about yourself, but about the enormous, what can I say, significance that this work has for people, those of us who do it. That the act of being with someone at the last moments, and like in your story with your grandfather, or even walking down the road toward the end, there's nothing else that compares.
No.
Once we've done that and really been through those experiences, we realize like, wow, everything else is just practice.
Yeah.
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 It might come close as maybe being a midwife and birth or something like that.
Definitely. Yes. When I did doula training, I was doing hospice at the same time. And I remember thinking at the time, like, actually, being with people who are dying is much more sort of, quote, convenient than being a doula. And so eventually I just stopped doing doula stuff because I just couldn't plan my life around it.
Possible to schedule, yes.
But the training is so similar. It really is about allowing a natural process that we've made scary culturally, but that doesn't have to be. making that natural process just something that we can witness and that rarely needs medical intervention, actually. It's our own fears about the unknowable that find us throwing medical intervention at things that our bodies know how to do. And the more we can become comfortable with what cannot be known, um, the better. I mean, I think for me, the more people I've been able to be with at the end of their lives. And for myself, like I will say I have died to myself multiple times, and just like, oh, I am not this person that I thought I was or that other people thought I was. And so what does this mean? And that when you emerge from that, there's like a capital F fearlessness about just life. Like you said, Till, like you're just like, oh, I mean, why was I so afraid of insert thing that now is put into appropriate perspective? And that when you're not afraid of yourself and when you're not afraid of what is true, you have more energy to be with what is true. I think we don't even know how much energy we spend pushing away what's just true, which is that we're all going to die and that we're all going to get sick and that like these bodies are going to break. And we could be graceful about that and kind of reclaim some of the energy and frenetic madness that goes around trying to make that untrue.
Isn't that amazing too, that that's some of the most satisfying work that many of us do somehow. And it's one of the things that sells the least. It's the hardest sell.
Definitely.
All my courses that talk about fixing a problem are super popular.
Yes.
I learned that at some point. It's like, if I want to fill a course, call it a problem.
Totally.
That's right. Yeah.
Yeah, maybe I need to work on my messaging for the end of life courses.
Yeah.
Fix your feelings about death.
Yes, totally.
Something like
Yeah.
that. And it's the same kind of philosophical divide we're talking about in the healthcare system between like, are we curing or are we dying?
Right. Because it's got to
not
be one
either
or the
or.
other.
Yeah, it's
We
gotta
have
be
to
one
have
or
a
the other.
binary. Yeah.
That's
Yeah.
right.
Yeah.
That's right.
So, in the 2 decades that you've been doing this, do you think that we've made some progress in terms of the narrative around end of life situations and like as a culture being less fearful about it and more open to talking about it? 'Cause, I mean, it seems like there's a bit more, and this is just kind of like me looking in from the outside because I'm not really well versed and immersed in that arena a whole lot, but it seems like maybe there is some movement in that direction towards recognizing these things and talking about it maybe just a little bit more. Do you think we're making progress, or are we just still kind of
I mean,
stuck?
yes, and people are gonna people, man.
Yeah.
Like it's just we can't even help ourselves. I do think that there are pockets where progress has for sure been made. And I think that, like if I were going to use an analogy from the massage world, 20 years ago, people were like, don't massage people with cancer. You're going to spread it. You're going to whatever, whatever. Now everybody's like, if you have cancer, get massage. But we skipped the part where you have to learn how to provide massage for people with cancer. Everybody just thinks it's okay. And I feel like we've sort of done the same thing with death culturally, that it's not taboo to talk about death anymore, but we're only talking about it. We're not going into it. We're not feeling about it. We're not really showing up to it in a way that like sort of pulls the veil back, if you will. That, I do think that it's not so taboo, but it's not because we've done some hard work around it.
Okay, you have a training, it's interesting training program we're going to talk about, but before we get there, what are the skills or mindsets or propensities that you think we could all cultivate that would help us be more effective in these realms?
Yeah, well, I feel like one of the things that is really missing as massage therapists is the sense that we are part of a web of providers and even of a world, right? That even if I am a person who sees people in my basement on, 2 days a week or something, that person that I'm touching has other people who care about them, has doctors, has other providers who are looking out for them. And so certainly I feel like we could do a better job of making actual connections with those other people. But even for us to just perceive that we are not the only person in this person's like care web can be such a shift in perspective about both what we carry in terms of responsibility, but also in what we imagine is possible in terms of like referral and additional supports for people. I think the other piece that this listening piece can't be, there's like, I wish there was a better word, right? Because listening feels so anemic, because what we're really talking about is embodiment. And like presence has also become a word that's just a throwaway, right? Like how it's about showing up to this moment with a capital S. And even if this is someone I see every week, I haven't seen them today, right? How can I bring that sense of like, I know a lot about this person and I don't know who they are today.
Mhm.
How can I know what I know and set down what I know so that I can be here? And that is a skill that it's not just a trick of your mind. It really comes from developing a robust vocabulary with your nervous system and being in that moment to moment awareness of, okay, right now I feel settled. Ooh, this is activating. How did I come out of activation? Like really kind of watching yourself move through the world and having a better understanding of how you work. Knowing you, that's the best class you could take, right? I mean, your hands will do important things. And if you know you and can be the boss of you, nervous system wise, that has such a deeply therapeutic impact in your relationship with other people.
Yeah.
And it's hard. I mean, it's not a weekend. It's not it's an immersive shift in perspective where you say like, there's nothing that I know that I can't know more intimately. And I want to know that thing more. I want to know myself more. People hate to be surprised by themselves, right? Because we all think we know who we are and we're like, this is who I am and I've locked it in. And when we start to change and when we start to shed and become tender and a lot of people, I think, just sort of retract from that. And that's really the invitation here.
It seems like one of the things that helps you be able to prepare for this, I think a lot, is a significant amount of life experience, having been through a lot of things. And I think that poses some real big challenges for those people who are entering our field, which is now an increasing number of them at a very young age without that kind of thing. And that kind of is like you're at a bit of a disadvantage without some real good, also strong training guidance about what you need to do. Like, how do you see us, like, is there a different way that we would address people who've been around for a while, been around the sun a couple more times versus those people who are still green?
Yeah, well, it's interesting that you say that, and I feel lucky that I found practitioners who have supported me and taught me in this perspective very early in my path as a massage therapist. And what I often say is that I didn't have to unlearn those habits of fixing, and it's like sort of from the very beginning, the people who became my teachers were people who continually said, "Why do you believe that?
Yeah.
Why does that feel true? You seem a little attached to that. You might want to wonder about it." And so, in that way, I think it can sometimes be even harder for the people who've been around the sun a few more times because
Mhm.
those patterns are so established and they've decided that those patterns serve them.
Yeah.
Where, when you have a younger person and you say, like, why are you so willing to buy into whatever this thing is that you probably won't serve them? And show me the proof. Take this thing that you're so sure about out into your life for the next week. And when we meet next week, tell me how it worked out. And let's really get curious about, there's so many stories we're told about how to be, quote, successful as people, as practitioners, as business, owners that are are from damaging systems that deserve to be questioned. So I feel like a lot of this really is about being willing to hear your own voice and give it value. And there's so many reasons why many of us aren't able to do that and why that's
Yeah.
an ongoing challenge. And
Mhm.
I think young people don't know it, but they're dying for that kind of guidance. But I think that's where those people who've been around the sun a few times can also say, like, oh, yes, that is a painful place to be. I see you. I see that. I wish I could save you from that. And let's do this together. I can actually probably help you shorten or at least soften that curve. But you're not wrong for being confused, and you're not wrong for feeling confident. And let's unpack this a little bit and really get curious about how to find that both and road and really continue to push back against this binary sense of good, bad, living, dying, curing sickness, all the things.
Old, young. I'm just
Yeah.
thinking about,
Yeah.
There's another one. Yeah, that's right.
right. Well, I'm thinking about how you talked about getting more entrenched in our habits. And I'm thinking like at some point I turned around and I'm orbiting the sun backwards now. Because like I'm unwinding all kinds of stuff and I'm getting less sure about things over time. And it's not that I'm getting younger, but I'm getting less certain about so many things. It is that moment, that over the hill moment when you start to find some certainty.
But sure, that's not just forgetfulness, right?
There's that. That
Yeah.
helps.
That can be good. Well, Eric Larson talks about the stages of life, and he's one of the only psychologists who talks about aging as a stage of life. And he talks about what we can potentially go through in that time. And is it a time where we are able to look back and say, my life has had meaning and this is how I want to reflect on it? Is it our last chance to bring meaning to our lives? Like, this is a stage in itself, and it's not the stage of selling your stuff and like getting smaller, right? I mean, it could be, but it is its very own stage. And there's real richness there that I think we just don't embrace or explore.
Mm-hmm.
You want to tell us about your mPATH program? And I want to just tell people how that's spelled. It's like small m, big PAF. So it's like, it says a lot right there and how you've laid it out. What's it about and how did you get inspired to develop this?
Yeah, well, so the acronym is Massage Palliative Advanced Training for Healthcare. So a little bit of a stretch, to make it into a fancy acronym. But at Healwell, we've been training people to work in hospital settings, inside hospitals, pediatric and adult hospitals, for about 16 years, and even that training has its limits, because that training, while we certainly involve a lot of communication and emotional regulation, it's a lot of hands-on how to do massage in this setting. And many of Healwell's service programs, where our massage therapists partner with hospitals and clinics, are through palliative programs. And over the years, we've learned so much by really being taken in by the social workers and the chaplains and the physicians and the nurse practitioners who really work together in as flat a system as I've seen in healthcare, where really everyone on the team is a palliative care generalist. Like, they've all got those advanced communication skills and an understanding of what this patient might need and how we all work together. And then there's the specialty within that person's discipline. So like anyone on that team could lead a family meeting, or could be in charge of the interdisciplinary team meeting, or could do the initial consult at the bedside when a physician says, hey, I think it's time for palliative care. And our massage therapists, even ones who've been working with us for a long time, weren't in that place yet. And we really started to think about what would it take to, what is a palliative trained massage therapist? And coming back to this piece about, if communication is the intervention, what do massage therapists need to know about communication to really participate in a truly integrative and value-added way in a palliative setting? I'm not even going to say on a palliative team, because again, palliative care happens in so many ways and so many places. But what about the palliative perspective isn't part of the massage therapist ethos or training? And it's been really exciting. So this year is the first year we're running the mPATH program. Is a 9-month program. It's we meet every week live on Zoom for 2 hours, and then students have between 5 and 8 hours of sort of additional coursework between. And then the last 6 months, in addition to those other things, they actually do an externship with a palliative care team that's local to them. So we have 11 therapists in this first run, working in programs all over the country. And in these externships, their preceptor, who we have a variety of providers serving as preceptors in these different programs, nurse practitioners, chaplains, social workers, nurses, their job is really to kind of do whatever they can to immerse this massage therapist in the palliative perspective. they're going to be shadowing other providers, doing those bedside consults. They're going to be attending those family meetings where everybody in the family has a different idea about what should happen for the patient. They're going to be going to rounds and really being a part of the team. And then as they become comfortable as part of that team, they will start to more incorporate providing massage therapy. But for the first 3 months, we're really kind of, we have an interdisciplinary faculty. So next week, we've got folks coming in from University of California, San Marcos, doing some ethics modules. They'll actually do 3 modules with these 2 instructors from the Shiley Haynes Palliative Care Institute over the course of the 9 months. And just really, what are the ethics of palliative care? What is moral distress? Why is it hard, quote unquote, to work in this environment? And how do we navigate that? The presenter who will come to class tomorrow is a pediatric palliative care physician, and she's going to talk about consult etiquette. How do we communicate with referring providers, and what do we need to understand about conflict resolution and communication, and how to notice when we have a chip on our shoulder so that we can really show up to this engagement where this person is trying to collaborate with us. But then we've also got palliative pharmacists coming in to talk to us about how are the symptoms of serious illness treated pharmacologically, and how can we work together more with the pharmacy team when we've got people living with serious illness. So a wide array of perspectives from different disciplines, but through that palliative lens. And we've got some people in the program who've been working in hospitals and even with palliative teams for years, who at this point in the program are saying, I had no idea what I didn't know. And like, I'm already bringing things back, and we're changing the way we do things at our program. And then certainly we have other people who've never done any of this work who are also like, oh, even if I never do this, I'm going to use this with my clients in my private practice. Or, how have I been doing massage for 16 years and I'd never heard any of this?
You've described some really practical and tangible nuts and bolts there, some skills and abilities and information there. And knowing you, I know there's also a philosophical or existential container there, or support that you're going to be inviting.
Definitely.
And a good job on selling the nuts and bolts. That makes me want to do it. That's why people sign up. They want those hard
that's
skills.
right. That's right.
Yeah, between us chickens here, it's like I love having you on the show. I love these conversations with you because of that bigger perspective that I know is behind it as well.
Yeah, there's definitely a container for that.
Yes.
One more thing I want to kind of ask that I don't think we've touched on this much in any of our previous conversations, but is there a flip side to this in terms of adverse events that can happen from, I don't know how to phrase it, but I'm just going to say like adverse events from bad palliative care intervention kinds of things. Like, again, sort of like, why is it really important to do the training? Because like, what can you mess up in this?
Yeah. Well, certainly, we could go to like dislodging blood clots and introducing infection, and like there are absolutely sort of nuts and bolts, like this could go real badly sort of scenarios. I would say the thing that motivates me and that motivates our team at Healwell is the main adverse outcome is people not understanding the value of massage therapists, including massage therapists. That, you can go into a hospital and massage sick people and probably nobody's going to get hurt, but is that the bar you want to set? What I want is when one of our providers leaves the hospital, that the nurses look at each other and go, have you ever met a massage therapist like that? They knew so much about the patient. They like asked me questions that I wouldn't even have thought to tell them about. And that's what's missing from even our private practices. Like there's so much more potential within this big, beautiful scope of massage therapy. And I would say that the biggest adverse possible outcome is us underselling ourselves and healthcare thinking that we rub because anybody can rub, right? And so, in terms of career longevity, if you can be replaced by a robot, you're not doing a good job. And so,
Well, I'm thinking about your question, Whitney. I'm not talking about your program, though, Cal. I'm talking about my own experience where the adverse events along my pathway and the ones I've seen were like injuries to the paradigm or injuries to the way I'm thinking about what's happening.
Yeah.
Or when someone comes in with a model that they're asking me to go with, or where it doesn't quite match where I'm going. Like, it could be, it can go either way. Like, you can beat this at a time when I'm working with acceptance, or it
Right.
doesn't really
Yeah.
change until you really admit your X, when really I'm not there yet either. But somehow mismatches in timing and process that can happen from not listening, from not following. Those are the
Absolutely.
events I think of.
Yeah, I
Mhm.
think that's one of the biggest takeaways that I think people pulled from the trauma-informed care sessions that we've had as part of the empath program is that we have to redefine harm. Yes, there's physical harm, there's visible, obvious harm, but we harm in like those very subtle but important and injurious ways that you just described, Till, like by plowing over people, by not listening, by going in with an agenda and trying to make the situation fit that agenda. And
Or unconscious assumptions or things we're coming from with the
absolutely.
best of intentions.
Oh yeah, totally.
I remember my first time I had a client who came back to me and told me she had a cancer diagnosis. I mean, I was young, so I cut myself some slack for that. But
Uh-huh.
before my eyes flashed, oh, she's done. This is death we're dealing with now. And
Yeah.
that was not helpful at all for me to even, I didn't say that, thankfully. But
Yeah.
Yeah.
in that process inside of me, I realized,
Yeah.
working with her over the next few months, I realized, oh, wait a minute. I need to approach this differently inside myself too.
Yeah. Yeah.
Yeah.
Absolutely.
Yeah.
All right.
Yeah.
I recall I was working with a chiropractor actually back in the 1980s, late 1980s. And this particular chiropractor kind of specialized in and had a whole lot of patients that were HIV positive. And this was during the time frame where there was a lot of fear and inhibition around touching anybody.
Yeah.
And that was one of the things that I just noticed, like, so prevalent. Like, I wouldn't think of like these people probably coming to a chiropractor for this, but it was the community that had been established around this practice of making it safe and open for these people to be touched. And of course, the massage therapy became a humongous part of that whole process for many of these people. And that's kind of like was a big sort of wake up call for me of this. It's not about really as much at all about what I'm doing in there with my hands trying to treat somebody or do some things. It was so much more about just the being there kind of process.
There were so many pioneers working with that horrible scenario that we're still learning from, still falling back on.
Absolutely.
many
Well, and
things.
I think people like I think I get a reputation as being like anti-technique, and I'm not. I have major neck and back issues that have been seriously helped by specific techniques. And when they're provided by a present provider who listens and shows up, it's more therapeutic. You can do to somebody and it can help them.
Yeah.
And if you can really show up, your techniques will be so much more valuable and
Yeah.
so much better received.
That's my next offering. It's going to be like supercharge your technique.
Yeah.
That's what yeah,
Sure.
you get people in, you lock the door, and then you're like, we're gonna have feelings, and then
That's
like
right.
you watch the mayhem unfold.
It's a stealth agenda. We'll do gently. Listen, before we thank our sponsor at the, who's helping this happen, what do you want to leave us with in terms of how people can find out more? You've given us some great resources in general. I got a couple of notes here we're going to put in the show notes. How can people find more about palliative care? How can people find out more about your program?
Yeah, well, you can there's lots of stuff out there about palliative care. Go to the Vital Talk website, download the Vital Talk app and hop around in there and see what you think. There's a great a YouTube show out of up in Wisconsin, a bunch of palliative providers called the Friday Chalk Talk Palliative Care, and they have
Friday Chalk Talk?
Chalk Talk. Yep. They sort of, make it like
Spell
they're
it.
in the locker room, like, like chalk on a chalkboard, you're drawing the
okay.
plays and stuff. And they have great, interesting guests on there, and it's free. You can just log in and check it out. Our program is healwell.org/mPATH. That's it. No hyphens, no capitals, nothing like that. We have a couple of info sessions actually coming up, 2 in May and 1 in June, because the application date for next year's program is July, I think it's 31st. I'm not the boss of these things, but it's July something. And I gave Till a bunch of textbooks and links to podcasts and other things that y'all should check out in the show notes. But
Good.
yeah. And we have a course called A Year to Live that launches the first week of May. It's a year-long course. We just meet once a month live, and then every week I share prompts and guidance that'll help you kind of sink into some of this stuff, maybe a little more gently than might happen in a shorter course. So we'd love to see you in there too. It's open to anybody. It does not confer CEs, but that means you can invite your spouse, your grandma, or whoever else you want to have do it with you. We've had family members do it together, sisters and siblings and parents. And so come and check it out. And, come to Healwell's online community. We have some real robust conversations in there, and we avoid the all caps, and we disagree respectfully, and we're doing all kinds of stuff in there to just help people really enjoy this work we do called massage therapy.
Yeah. Well, absolute kudos to you and the whole Healwell community for all of the things, the resources, the learning, the teaching, and everything else that you all have brought to our field, because it has been a tremendous gift and so badly needed. And you all have done just a wonderful job of that over the years.
Thank you. Thank you.
And on that note, Cal, thanks again so much for joining us. And we would also like to thank Books of Discovery, who's been a part of the massage therapy and bodywork world for over 25 years. Nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. Books of Discovery likes to say that learning adventures start here, and they see that same spirit here on the Thinking Practitioner podcast and are proud to support our work, knowing that we share the mission to bring the massage and bodywork community thought-provoking and enlivening content that advances our profession.
And here's a cool thing. I know we have a lot of educators, teachers, administrators that listen to the show. If you're an instructor of manual therapy education, you can request complimentary copies of Books of Discovery's textbooks to review for use in your own programs. Listeners, like anybody, can explore their collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at booksofdiscovery.com, where listeners can save 15% by entering Thinking at checkout.
And thanks to all of our listeners. We appreciate you hanging out with us here. And thanks again to our sponsors. You can stop by our sites for the video, show notes, transcripts, and any extras. You can find that over on my site at academyofclinicalmassage.com. And Till, where can they find that for you?
My site, advanced-trainings.com, where we post the podcast as well as other resources and ideas. We want to hear your ideas and your input, your feedback, your guest suggestions, your questions you're grappling with, your quibbles, your compliments. Email it, any of that. Email us at info@thethinkingpractitioner.com, or look for us on social media and YouTube under our names. My name, Till, Luchau, Whitney, Lowe. What is your name?
Today and most days, my name, Whitney Lowe. You can find me over there as well. So people can find us under those locations over there. And if you will, please remember, we'd really appreciate it if you would rate us on Apple Podcasts, as it does help other people find the show. And you can hear us wherever you happen to listen to your podcasts. Please do share the word and tell a friend. And again, Cal, thank you so much for being with us today. Wonderful to share some time and space with you again.
Thank you,
guys.
Cal.
Always a treat.
Okay.
See you next time. So glad that you'll be moving closer to where I am. And thanks again
Yes.
for joining us on the show today.
Thank you, guys. Big love to you.
All righty. Okay, see ya.